On Capitol Hill tonight, more debate over a handful of cabinet picks from President-elect Trump, in particular among Republicans.
I think the Senate should do everything they possibly can to approve those and to nominate them and get them through the confirmation process.
There are, I think, a number of nominees that have got a lot of tough questions to answer.
One of the nominees that could face a confirmation battle, Trump's choice to lead the Department of Health and Human Services, Robert F. Kennedy Jr. Some lawmakers expressing concern over his anti-vaccine activism, questioning whether he should oversee the nation's public health agenda.
CBS 58's A.J. Byatt today talking to former Wisconsin Governor and HHS Secretary Tommy Thompson, and now he joins us with more on his perspective. A.J.?
Well, Jessup, Natalie, good evening. The message from Thompson, who left the governor's office to serve as health secretary under George W. Bush, is Kennedy should get an opportunity to show how he would address obesity, how he would regulate pharmaceutical companies, and how he would approach vaccine research. Some of Kennedy's past vaccine statements have led to widespread criticism, but Thompson says members of the Senate and public should have an open mind toward RFK Jr.
Give him a chance. Before you start criticizing and tearing down and saying it's going to be terrible, let's see what he really means. Let's see what he really is going to do.
Former governor and U.S. Health Secretary Tommy Thompson says he is encouraged by President-elect Donald Trump's decision to appoint Robert F. Kennedy Jr. as the next Secretary of Health and Human Services.
When I was there, I was concerned about obesity, diabetes, and Alzheimer's. Still big problems today, and Robert J. Kennedy Jr. is willing to take those on.
Most of the criticism around Kennedy's appointment stems from his past comments about vaccines.
Smash COVID!
Thompson himself pushed for people to get the COVID-19 vaccine as president of the UW system. He does not see Kennedy as anti-vaccine.
But I think what he said, let's make darn sure that all vaccines are scientifically based and are good for the American public.
Kennedy has raised eyebrows with some of the things he said about vaccines and COVID-19.
There's an argument that it is ethnically targeted. COVID-19 attacks certain races disproportionately.
Others in the field view Kennedy differently. UW-Madison doctor and Professor Bill Hartman wrote on X, quote, "I believe in science, I believe in vaccines, I believe in keeping my family and community safe. With none of those credentials and armed with misinformation and debunked theories, Robert Kennedy Jr. has been given a seat at the table to decide what is best for public health." Hearing that level of concern from researchers within our UW system, does that give you pause at all?
No, it doesn't, because what he also said is let's see how it goes, and let's make sure that the medicines and the vaccines that we are producing are safe and healthy for the American public. I think that's fair. I think it's the right approach.
We did reach out to Dr. Bill Hartman for an interview today. He did not immediately respond. In our interview, Thompson says he does support children being vaccinated, quote, for the diseases that have been causing problems in the past. Natalie and Jessup, he says he does not view Kennedy as a threat to that practice.